You walk past a bakery. The smell of freshly baked donuts and cinnamon rolls fills the air, and you think, maybe I'll just have one. I'm no stranger to this. I love my sweets. Probably why I took up cycling, so I could justify a donut or two to fuel my rides. The irony isn't lost on me. You see, my full name, Madhu, actually means sweet. So yes, I'm an oncologist who loves sugar, is fueled by sugar, and is technically named after sugar. But in my clinic, I often hear something different. Imagine, I'm sitting across from a patient. Let's call her Sam. She leans forward, lowers her voice, and asks, "Should I cut out sugar? I heard sugar feeds cancer." And then it transitions to, if I cut out sugar, if I change what I eat, can I keep the cancer from coming back? Sam isn't asking about calories anymore. She's asking about control, about hope, about survival. But here's the truth. As a breast cancer oncologist, I've learned that cancer isn't that simple, and neither is life after it. There is no one-size-fits-all approach to cancer treatment or recovery. It's not just about surviving chemotherapy or avoiding sugar. It's about finding the sweetness in life again, the joy, connection, and confidence that make surviving worth it. And that's what I want to talk about today, what it really means to live beyond the pink ribbon. You see, we are living in an extraordinary era of cancer research. Artificial intelligence has yet to take over our jobs, but AI is now being incorporated into advanced imaging modalities and pathology. In addition, fragments of tumor DNA can now be detected in the bloodstream even before cancer shows up on imaging. And when it comes to treatment, there now are a multitude of novel agents beyond traditional chemotherapy. In my work, I've been fortunate to help bring global clinical trials to our cancer center, giving patients access to innovative therapies they might not otherwise receive. We've also streamlined access to genetic testing that can shape care for both patients and their families. And drawing on the latest evidence, I've collaborated with other experts in the field to create national consensus recommendations, helping guide breast cancer treatment across Canada. It's fascinating science. It's hopeful science. But science alone doesn't tell the whole story. Because even with all this progress, I'm seeing more and more young people being diagnosed with breast cancer, all building careers, raising families, and traveling the world. They're not just surviving cancer, they're living with it. When the intravenous line is removed and the bell is rung, that symbolic moment many cancer centers use to mark the end of chemotherapy, there is a burst of celebration, hugs, and selfies. But after the celebration, many quietly wonder, now what? Because survivorship isn't an endpoint, it's just the beginning. Through my experience as a medical oncologist, I have seen that being a breast cancer survivor is about more than just making it through treatment. It's about emotional resilience, self-determination, and perseverance. I remember attending an international conference in Chicago. Microphones lining the tables, sharp suits being worn, world-renowned experts filling the room discussing the latest data, when one oncologist suddenly stood up and asked, "Well, what's the point if our patients can't have or even enjoy sex after breast cancer?" Yes, I'll admit I blushed, but the room suddenly came alive after that comment, because that's a conversation we don't have enough of. How can we help our patients thrive after cancer treatment? How do we help them feel whole again in their body, relationships, and sense of identity? I'd like to break this down into 3 parts: mind, body, and soul food. Let's start with the mind. When the treatment is done, one of the very first questions I frequently hear is, how do I know I'm cured? That invisible weight, the fear of recurrence, lingers long after the chemo ends and the hair grows back. While the body is healing, the mind can stay busy, gently hopping from one thought to the next, replaying worries and what-ifs. Many people describe this as the monkey mind, restless, noisy, and hard to quiet. We are exploring tools like circulating tumor DNA, otherwise known as ctDNA, those fragments of cancer DNA that float in the bloodstream. One day, ctDNA might help us identify disease relapse earlier. But right now, it's still in the early phase era, more like the flip phone era of the technology. It's promising, but it's not ready to guide daily decisions or replace reassurance, follow-up, or the emotional work of healing. So in the meantime, I think the mind needs just as much care as the body. Research in integrative oncology shows that mindfulness can ease anxiety and fear of recurrence. Through meditation, yoga, and shared reflection, survivors learn to calm their mind and live in the present. And yes, that final yoga pose, my favorite Shavasana, where you're simply lying still and hoping no one notices if you fall asleep, that still counts as healing. Which brings me to number 2. Now, imagine if we had a pill that could improve survival, reduce the risk of recurrence, lower the risk of secondary cancers, boost energy, stabilize mood, and bonus, a pill with almost no side effects, aside from maybe a little bit of soreness the next day. And so what exactly is this novel pill, you ask? Well, some physicians have candidly coined this drug exorcizumab, or simply exercise. It's exercise. This term started trending when a recent New England Journal of Medicine study, the Challenge study, looked at structured supervised exercise after chemotherapy for patients with high-risk colon cancer. They found that in the exercise program group, compared to the group that just received educational materials, had improved disease-free survival and had a 7% benefit in overall survival. This was huge and caught the attention of several media outlets, demonstrating the simple benefit of exercise. Exercise! Not a new drug, not a complex infusion, just movement. Observational studies among breast cancer survivors suggest similar benefits from exercise, though research is ongoing. Even the American Society of Clinical Oncology guidelines formally endorses exercise as part of routine cancer recovery. But supporting the body is not just about sheer muscle strength. It's also about reclaiming parts of the body that cancer treatment can disrupt, including sexual health. When my patient Sam undresses for bed at night, she catches a glimpse of herself in the mirror and pauses. She's not just seeing scars, she's learning how to recognize herself again, a body that feels unfamiliar, physically and emotionally. Pain, vaginal dryness, hormonal changes, body issues, all of these can affect sexuality and relationships. A large study in the Netherlands that followed more than 30,000 breast cancer survivors showed that even 10 to 15 years after treatment, many women still reported challenges with sexual function and intimacy. This is not a short-term side effect. It's a long-term reality. Sexual health remains the elephant in the room, even though it is a major part of quality of life. And if we don't ask, we won't know. And if we don't know, our patients will suffer in silence. The body deserves a chance to heal fully, through movement, through connection, through conversations we've been too hesitant to have. And healing doesn't stop at the body. It extends to the soul. Which brings me to the final pillar. Soul food. No, not the deep-fried kind, but nourishment in its truest sense. When it comes to food and diet, there is so much information and, by extension, misinformation out there. Miracle supplements, vitamin infusions, mushroom teas, alkaline water, keto diets, low-carb, paleo, GLP-1 agonists, intermittent fasting. Whew, it's exhausting. But the truth? It's simpler. I believe we must focus on whole foods, not fad foods. Remember that saying, an apple a day keeps the doctor away? Well, turns out there is some truth to it. Many of the key nutrition guidelines for cancer survivors echo these recommendations. Maintain a healthy weight. Eat a diet rich in fruits, vegetables, grains, and lean proteins. Limit processed foods high in saturated fat or added sugars. Limit red meat consumption and alcohol consumption. Ultimately, it's about reconnecting with real food to help survivors rebuild strength, restore energy, and reclaim a sense of control over their bodies and health. Now, there's been a lot of buzz lately around GLP-1 agonists. You know, those weight loss injections originally designed for diabetes that have unexpectedly taken over the spotlight. Well, naturally, many patients have asked, could these medications not only help me lose weight, but maybe even improve long-term outcomes for cancer? It's an excellent question and an area of active scientific interest. But the truth is, we don't yet know. Current evidence is preliminary and not yet conclusive. So in the meantime, I often tell patients, the guidelines recommend to shop the perimeter of the grocery store. That's where the real food lives. And yes, I think it's okay to go in that bakery and enjoy a sweet or two. The real cure isn't about eliminating cancer cells. It's about restoring wholeness to mind, body, and soul food. When we understand how these three pillars transform survivorship, it becomes less about fear of recurrence and more about reclaiming strength, agency, and life. Change starts with conversation. When we bring awareness to these often overlooked aspects of survivorship, we open the door for healing beyond medicine. My goal is to help start that dialogue. So yes, my name means sweet, and maybe that's fitting, because when patients like Sam sit across from me, what I want them to know is this. Life after cancer doesn't have to be sugar-free. It's full of moments that are beautiful and real. So when I say go beyond the pink ribbon, I mean this. Let's go beyond awareness, beyond the numbers, beyond silence. Let's kickstart the conversation. So here's to science, survivorship, and most of all, a sweet life beyond the pink ribbon.